my grandmother passed away. I don't know, maybe I was 7, 8 years old when she passed away, and I'm 44 now, and I still don't know what she passed away from. So,
Wow.
so,
Yeah.
so that's completely different. So, the talk of medical history and diagnoses and things of that nature never really like. I can also say I don't remember even going to the doctor myself unless I was like sick. So like how
Hey guys, welcome to another episode of the Being Rare podcast, where we have intimate and sometimes difficult conversations about living with rare diseases, disabilities, medical complexities, and special health needs. Today, we are continuing the conversation about the importance of knowing your family's health history. October is National Family History Month. It's a great time to talk to your family about your history and your stories and see how it relates to how we're living our lives today. But specifically for today's conversation, we're talking about family health history and how knowing as much as you can about your family's health can create better health outcomes for you and your individual family. Joining me for today's conversation is my honey, Kareem Edwards, and my dear friend, Heather Gjesvold. Thank you both so much for being here with me today.
Thank you.
thanks for
Good.
having
Yeah, good
thanks for
stuff.
having me.
Good stuff. So we had a conversation a couple of days ago with some other folks. They were here kind of representing organizations and their own perspectives, of course. And we were just talking about family health history. Just like with them, I have had conversations with both of you about how important it is to know your family's health history and unfortunately how sometimes we don't talk about it enough. I know for me, growing up, um, we didn't talk about our family's health a whole lot. It was private. It was taboo. You didn't have conversations about what folks had going on. So I kind of wanted to start the conversation there. Um, what was that like for you? Just growing up, was talking about health and doctor's appointments, was that something that was just routine in your families, or was it something that was kind of withheld in private? You just knew something, a doctor's appointment was coming up, but you didn't really know any details about it. Like, what did that look like for y'all?
For me, my mom is a nurse, so medical conversation was very easy. A lot of our dinner conversations revolved around medical issues, whether it was our family or just in general. So it was very open, and they were always open with me about my grandparents, my great grandparents, aunts, uncles, things they were going through. And granted, it was age appropriate,
Yeah.
so we didn't have personal conversations like that when I was, elementary school, but especially when I got to middle school and high school age, I knew that, certain family members were going through health issues. And for one, with my grandmother, she had ovarian cancer and died when I was 13. So I knew leading up to her passing what she had, what she was going through. We made special trips to visit her. So it was a common conversation. And I've tried to do the same with my kids.
Yeah, that's really,
Yeah.
really important. And what about you, Kareem? Like, what was that like for you growing up?
Yeah.
Was it just
Yeah.
routine conversation?
Yeah, I was going to say totally, totally and completely contrasting Heather's story. For example, my grandmother passed away. I don't know, maybe I was 7, 8 years old when she passed away, and I'm 44 now, and I still don't know what she passed away from. So,
Wow.
so,
Yeah.
so that's completely different. So, the talk of medical history and diagnoses and things of that nature never really like. I can also say I don't remember even going to the doctor myself unless I was like sick. So like how how we do our kids, annual checkups, shots, whatever. I can't say I recall those things as a child,
As a kid, yeah,
adolescence, and a young adult. Yeah, no,
yeah, going
none of that.
often.
Yeah, none of that.
I think for me, I don't recall us having like in-depth conversations. You know, the family member who drinks all the time.
Right,
It was just he drinks. It wasn't, I mean, it was honestly, it was alcoholism. I mean,
right,
he was an alcoholic, but nobody ever called it that. It was just routine to acknowledge the fact that he drank all the time.
right.
And I think that's one of the challenges too. Like I think we and that's a good segue into, the next perspective I wanted to get from you guys. You know, I don't think we call it for what it is because of that fear of judgment and
Mhm.
and the stigma that comes with um true diagnoses. And the conversation that we had before this one with my part one of this conversation, they were actually talking about mental health and was just talking about the stigma around mental health. And so I think we have to move away from that and identify it for what it is, because that's the only way you know what you're dealing with. That's the only way you can prepare for it. Um, and so that's kind of my next question for y'all. Like, why do you think there's so much stigma around health diagnoses? Why do we get so caught up on the negative aspects of real health issues rather than just calling it for what it is, so we can try to, number one, be helpful, but then number two, recognize how it might impact our lives and the children that we bring um, into that family dynamic. Like, just what are y'all thoughts about that?
I think part of it, even now with social media, everyone wants to appear perfect.
Yeah.
Like everything's going great. There's no issues in my family. But when you start talking about it with someone, that's when you realize, oh, they're going through something similar. And it makes them relax some and think,
Mm-hmm.
I don't have to be perfect.
Mm-hmm.
And part of my family history is my mom was adopted and all of her siblings were adopted. So we don't know a family history on that side. So I think
Mm-hmm.
part of it makes it so we're more aware on my dad's side to focus on it.
Yeah.
But even on my mom's side, I mean, there was alcoholism, like you were just talking about. And it was very open, even as a kid. And my mom has said many times, I wonder if I should have talked about it with you, if I should have kept it secret, because it wasn't pretty
Yeah.
Right.
with my aunt and uncle. But it was very open. And I have always been open with my kids and with other people. And with drinking, I'm like, I've seen what people can go through. I'm not even getting involved in that.
Right.
It's
Mm-hmm.
Yep.
not worth it to me. So I think there's such a great benefit to talking about it because you can avoid things, but also it puts other people at ease to know, hey, somebody else is going through this. Let's talk
Mm-hmm.
about it.
Mm-hmm. Mm-hmm.
Absolutely. Yeah, I
Yeah.
100% agree. Like,
Mm-hmm.
uh, I don't think I don't think it's a new thing, but social media has magnified it. The fact that
Mhm.
nobody wants to have flaws,
Yeah.
everybody
Mhm.
wants to be perfect. But
Right.
now social media apps have made it to where I can put away or I can hide my scars behind these filters,
Mhm.
and I don't think that's just a visual thing, but also a personality thing. I have flaws in my personality that I would love
Mhm.
to hide, right? So
Mm-hmm.
alcoholism is one. If I'm being honest, my certain members of my family made me to believe that was part of our identity to be an alcoholic,
Mm-hmm.
which didn't sit right with me. But it's like whatever, right? But yeah, I 100% agree that now with my kids, I like to discuss things like that to
Mhm.
help them um, maybe not avoid those same mistakes, but at least be aware,
Mhm.
right? So if we're
Mm-hmm.
not making if we're not making the next generation aware, then we're doing them an injustice, I think.
Right.
That's a really good perspective. Just, I mean, because we are really, really intentional to, have conversations with our kids about different things that we're going through. I know I had to have a hysterectomy back in July, and making the decision to not that I was not going to share it, but when I decided to let my mom know that I had made the decision to have that procedure, she just started talking about, oh, well, and this person had one, and this person had one, and I had never heard it before. And so I was like, that was one of the first questions that the doctor asked me, had anybody else in my immediate family had a hysterectomy. And and I knew of one person, my sister. She had a procedure, and if I'm honest, I don't even know her full procedure of what she had done. But after chatting with my mom, I realized that it went so much further back, and I just found it really, really interesting because it had never come up before. But again, like I think it's just one of those things to where we feel like we can't talk about it, and kind of like you were saying, Heather, about that age appropriate conversation. I think for some families, at least it feels like it for mine, nobody was ever old enough to have the conversation. Like even when you were old enough, it was still a conversation that you avoided. Like you just didn't want to talk about that kind of stuff. So just while we're right there, just me talking about my own hysterectomy, I know that you both have medical conditions in your family that you've dealt with. I know, Heather, for you, it was ovarian cancer. You had a history of that in your family. And then Kareem, for you, it's sarcoidosis and ALS. And so I wanted to just kind of talk a little bit about that. Like when of a diagnosis, how do you use that information to kind of prepare yourself for the possibilities, because you don't know. But when there's a genetic inheritance or a possibility of a genetic inheritance that you're aware of, I think that gives room for you to think about it. So I'm just curious, how did having that information help you just on your own personal health journey? What do y'all
So
got?
for me, with the ovarian cancer, I said my grandmother died when I was 13, and she was only 64 at that point. And then I came to find out her mother had died of ovarian cancer at the same age. And my grandmother was diagnosed in her 50s, which that's young. And now I see it as even younger as, versus when I was a teenager. But we talked about it, my parents talked about it with me. And I knew that as soon as I had kids, I was ready. Hey, take everything out, because I don't want to have to risk going through what I saw her go through. So my husband and I, when we were even dating, I had told him about it and said, this is what I'm thinking. And I just want to know what I'm facing and make sure the doctors know. So we had said we wanted to have 2 kids. And, if God blessed us with that. So when we had our second kid, I told my OBGYN, I said, and I'd already told her about the family history. And fortunately, we have printouts of my grandmother's medical records. Wow. So my mom got those from the hospital where my grandmother had been treated. So I had documentation, which was good to know exactly what kind it was. So I told my OBGYN, and she said, you're just too young, because I was only early 30s, like 31. So I pushed it and said, I really want to go to an oncologist to get their opinion on this. So she made an appointment for me at a GYN oncologist, and I went, and he said, you know what? I wish more people would do this. I wish more people would come to me at this stage rather than, hey, I knew I had a family history, but I just was hoping it wouldn't happen to me. So he put me through genetic testing and found that there were some alarming things that he wanted to go ahead and look at. So did things like ultrasounds, and he found a cyst and said, I really don't think it's anything major, but with your history, we probably need to go ahead and take care of this. So at 33, I had a full hysterectomy.
Wow.
And the odd thing about it, and I don't know if it's odd necessarily, is I had such a peace the whole process. And my husband was very worried. I mean, anytime a loved one's going through surgery, but I went to the appointments by myself, and he asked every time. I'm like, no big deal whatsoever. And he went to the last appointment, scheduling it and all. But I had a peace knowing I've prayed about this and I know this is the right thing to do. And the doctor was very encouraging, saying this was the right path. So I felt like it was the right thing to do.
Wow.
And had a full hysterectomy. And the thing is, my dad only has a brother. So there weren't any girls in that generation for us to see, hey, did it skip a generation? Did it hit that generation? And I didn't want it to continue.
Yeah.
Right.
So decided I'd go ahead and get the full hysterectomy and hadn't looked back. It was the best decision.
Wow.
And that cyst was fine too, so which was a relief, but that didn't even worry me. It was like, this is God's way of saying, you need to have this done. You're doing exactly what you need to do.
Right. And you know what? And before you jump in, I just got to say that is taking charge of your health. You know what I mean? Like that's really being in control of something that you can, like, because once sickness hits,
right?
How many patients, and I've heard it more from cancer patients than probably anybody else, but how many patients feel like they've lost control once the actual illness hits? I just heard a cancer patient a few days ago said, she said that she shaved her hair herself before it could fall out. And to her, that was being in charge of something that she could, because she knew she couldn't control the radiation. She couldn't control the chemotherapy. She couldn't control what the cancer was doing to her body, but she could control when her hair fell out. And
and I didn't want to have regret knowing I had this family history and I did nothing.
Right. You did.
I mean, even if I'd gone to the doctor and I fully expected him to say, let's do some testing and just monitor you for 10 years or whatever. I did not expect it to move that quickly, but I knew God's hand was in it the whole time. And I was doing what I needed to do to take care of myself.
It's great that you had a medical team that supported your concern, because that doesn't always happen in the healthcare space too. Kareem, I want to hear from you. Go ahead.
No, I was just gonna say that was key. I think to having the right people in place.
To have a medical champion is huge.
We've learned that with our own son that every doctor doesn't hear your concern and act on it in accordance to your desires, right? Like they a lot of times they depend a lot or mostly on their education, and that's good, I think, but as the patient, I think my wishes should factor into your education, right? So I think that was huge. But yeah, as far as my folks, particularly my father passed away from from ALS, sorry. And kind of like Heather, he was a young guy. Like I think he was maybe 49, maybe. Wow. And so that raises concern with me. Turning 40 now, 44. And I think the average expectancy for ALS is maybe 5 years. So and so that brought me to recently, I've had some concern with my own health, like some goings on and happenings, and that caused me to like Heather, speak to my physician about these concerns, and we're doing some testing here in the next week, and so it helps me to be more open with my physician about how I feel and what my concerns are. And I think in times past, or without that knowledge of my father's diagnosis, I probably would have been more secretive about it, like or dismissive, I
A
guess. Not
brush,
secretive,
yeah.
dismissive is more the
Mm-hmm.
word, I think. But it's important. And then my mom, she passed away from sarcoidosis, which I don't know a lot about. I was a lot older with my mom, an adult even, but not being there the same as with my dad. Like when my dad passed away or was diagnosed, I want to say I was 17, maybe 16, 17 years old, and even within the severity of it, as a kid, I couldn't grasp or digest
Mm-hmm.
what it all meant. I knew he was sick and knew his health was declining, but as a kid, you just think, oh well, my dad's sick. But now, again, being an adult and um, having concerns of my own, like uh, I think seeing that helps me now. And again, like I said earlier, it also helps me to be more open with our kids about their health and our history, making sure we're transparent with, as Heather said earlier, age appropriate
Mm-hmm.
transparency. You don't want to give them everything, but you want to give them enough to
Mm-hmm.
pique to get their curiosity and have
Mm-hmm.
them ask questions
Mm-hmm.
so that you can be age appropriate, right? So you
Mm-hmm.
don't just dump stuff off on them, but you can
Yeah.
answer their questions. What is this? Why is this? And you can kind of navigate that conversation with them. So I don't know. Does that answer
Yeah.
what you were looking for?
Yeah. Yeah. It does. I think, a couple things stood out. The fact that, you were a teenager with your dad. And so the first thought is when it's already something that you don't really talk a lot about, you don't know
Mhm.
a lot about it, in your mind, it's just like a cold. You know what I mean? Like you don't think
Right.
about the severity of it because those conversations aren't being had. And that's,
Right.
that's nothing against our families or anything. Like I don't resent my family for not having those conversations with us.
Right.
It just because we didn't, and now I'm more aware, it helps me be more intentional with
Mhm.
my children. That's what it is. Like I totally get that. It's a place of discomfort for a lot of people,
Mhm.
and it's a place of privacy. I know we had a family member, um, they got COVID, and they're getting COVID uncovered so many diagnoses. And we were all like, wait a minute, what? And the family member was like, oh yeah, I knew about that. Like I knew about that. Like they knew all those diagnoses, and but none of us did. And I think the only way we did it was because we were so hands in, because we didn't know a lot about COVID. And so
Mhm.
all this other stuff was being uncovered, and it just really made you question, well, goodness, and so now, like, I know I found myself asking other family members, well, did you know? And everybody
Mhm.
was like, no, I had no idea. I had no idea. I had no idea. And so, like, I think we have to remove um, the taboos of having these type conversations, because if you find yourself in a place to where you can't communicate what's going on with your health for yourself, you want to be able to have someone to speak on your behalf.
Mhm.
My grandmother is 84. I think my grandma's 84, maybe 85. And I remember, she wanted her birth certificate, and we tried to get it for her, and there was no record of it. And so, you know, so all we have is what she can tell us about whatever somebody else has told her about that process, and about that her being birthed into the world, and any
Mhm.
documentation of it. Like I think it's just really important that we talk about those things, because it's not a paper trail for a lot of people. It's not.
Right.
Everybody doesn't have that documentation. And so I think kudos to you, Heather, for your mom being able to get medical records and you
Right.
be, you being able to provide that, almost like pleading a court case, like this is
Yes.
my evidence.
Right. Because my OBGYN thought I was too young to even consider doing
Yeah,
anything.
right.
And I asked multiple times and I said, I really want an appointment with an oncologist. And they may say the same thing, but I've got to know I've done my due diligence to see what I need to do in the future.
Exactly.
Um,
Exactly. Exactly. So this has been such a great conversation. I think just one of the last things that I want to just kind of leave our audience with is, um, you've heard from our panelists, from our guests about the importance of knowing your family history and really the benefits of it, the success story that Heather has already experienced with being able to get a procedure done and not have any conflicts, and even with Kareem being able to have conversations with his doctor, which we're hopeful that is nothing, but having information about different things that his family has already experienced. He can take that information to those conversations and have informed information to share with practitioners. um, Last thought, why is that so important? you know what does being proactive about your health do for your family's legacy, the children that you have birthed into the world? um, why should we care enough about our family before us as we build the family coming behind us?
I think an important aspect is it gives us a better understanding of who our, maybe our parents and grandparents are, what they had to go through. And you see these struggles with health things that you don't want to go through and you don't want your kids to have to go through. And if there's anything you can do just by being proactive, talking to your doctor, looking for signs, why wouldn't we do that? Don't we want the best for future generations?
Mhm.
And with my mom being adopted and we don't have a family history on that side, I think it makes us even more aware of, hey, we do know these certain things, so let's address it.
Yeah.
And honestly, when I was thinking about this topic, it made me think on my grandmother and, grandparents in general. And it's kind of neat to look back and bring up memories, even if some of them are negative with the things they had to go through with their medical history. Just talking about it with your family members brings up those neat family stories too. It's not just medical. And that way my kids know my grandparents, their great grandparents, that they never had a chance to meet. But we can talk about it. So don't let your conversations just be about, hey, your great grandparent went through this. Let it be, they went through this. You need to be aware for your family history. But, let me tell you this cool story about who they were, what they did. And some of it's similar to what they're like, the personality traits that go through. So it's not just family medical history. It's, family traits, characteristics that's cool to bring up. So don't let it just be a focus on health, because nobody wants to talk about health problems all the time.
That's right.
Right.
And that's a great way to have the conversation. Just slide it in to
Right.
a normal conversation. Kareem, go ahead.
No, yeah, no, I was just gonna say, for me, just like I said a minute ago, awareness, like, um, so that you don't, I guess, feel like doctors are places where you go just because you're sick, but you go, that's that's the icing on the cake, if you will, to have a doctor available for when I am sick, but also to monitor my health, right? So I think, again, without the knowledge of my dad's diagnosis, um, my something like my arm tingling or my fingers tingling would have been dismissed previously, as, oh well, it's this or that or the other. But because I know of my dad, it made me, not fearful, but definitely concerned as to, what's going on with me. And to Heather's point, I think we should, uh, not just remember my grandfather or my dad or whomever in my family history had cancer or, diabetes or whatever, high blood pressure, heart problems. but we also should remember them for the great things that they did. Number one, being there so I could be here, right?
Yeah.
And then and so that's a different perspective to have on it, I think.
Yeah.
So I appreciate that, Heather, that insight.
Mm-hmm. That is really good. All right. Well, we appreciate you both so much for hanging out with us. Guys, this is part 2. So make sure you watch part 1 of this conversation, Know Your Family Health History. You can find more episodes of the Being Well podcast on the iwifoundation.org// whatever you say, podcast. If you have not subscribed to the Being Well podcast, do so wherever you listen to your podcast. This is National Family Health History. Nope, this is National Family History Month. Make sure to share this episode with a family member, share it with a friend or a colleague, anybody who you think will find value in our content. Until the next episode, be rare. Thank you guys so much for being with us today. We appreciate you so much.
Thank you.
Thanks. All right.